Good morning, everyone. My name is Flora, one of the steering committee members of GPON. It is a privilege this morning to introduce a very significant topic that touches all of us. Humanitarian crises are with us all the time, whether we experience them from afar through the media or closer to home. They impact us all in different ways. And for nurses living in areas of conflict and in humanitarian areas, it is more important, particularly for the patients who are suffering from cancer, because the burden is huge and we cannot begin to express how huge it is. And this is an area that needs much recognition and much talking about. And we are privileged this morning to have incredible people to share their experience. Today's journey will take us to Palestine with Mark Fowler in discussion with three incredible people. Mark Fowler is a consultant nurse for cancer services at University Hospitals of Derby and Burton NHS Trust in the United Kingdom. He has experience in cancer nursing, palliative care, and as well as teaching. So today's journey will take us to Palestine, and he'll be in discussion with Tama Al Jafaris, a palliative care nurse, Jihad Hawamda, a nursing education officer, and Dua Alisa, palliative care nursing teacher. It is a privilege to have all of you this morning to share incredible experiences that we can't share from afar, but which you experience every single day. And thank you for joining us. And it's over to you, Mark. Mark, can you hear me?
I can hear you. Can you hear me?
Yes, I can hear you.
Can you see my screen at all?
I can't see. Yes, I can see your screen now in the background, showing all the great work that you do. It's over. Yeah, and it's over to you. Thank you so much for taking time to have a discussion on this particularly important topic that's really under-recognized and needs much acknowledging and bringing awareness to. And GPON is on this day giving us the privilege of having that experience. Over to you.
Thank you, Flora. It's an honor to be here. I'll just wait for my slide to load. So yeah, that's me. I'm Matt. I'm a consultant nurse for cancer services in a large cancer centre in the East Midlands, and I'm fortunate enough to be an honorary lecturer on the MSc in Cancer Nursing and Palliative Care Nursing programme at Bethlehem University. And prior to the events of last October, I was visiting West Bank and Gaza on a very frequent basis, teaching at the university and equally being fortunate enough to work in hospitals across the West Bank and Gaza. Since then, I've been teaching online, and I'm definitely hoping to get back out next year. And I've been doing this for about 8 years now. But the biggest benefit I have from doing this, for me, from a very selfish point of view, is that I've made many great friends across Palestine now, some of whom I'm very lucky to be on the platform with today. So I just want to discuss a little bit about my experiences out there, but ultimately this isn't about me. This is about the most important people in this webinar, and these are the three nurses that I'm going to be talking to today. And that's a picture of me with my, it was the diploma at the time. That's a picture of me with my diploma students at Al Najjar Hospital. That's going back a little while now. I've got a lot more hair on my head then than I have now. Yeah, next slide, please. So, and that's interestingly a picture of me in Gaza last year. And I'm at the Turkish hospital, which I use the past tense, unfortunately, which was the main hospital for cancer services in Gaza, and I'm there with one of the clinicians. We'd started to set up a program so that we're introducing hematology nursing competencies for the team, and unfortunately, that's all it's all gone now. It just doesn't exist anymore. So we're not able to do anything at the moment, but certainly, as my colleagues would say, inshallah, in the future, certainly hope to be able to do something. The Turkish hospital had both inpatient and outpatient haematology and oncology services, as well as palliative care services as well. Got exposed to many things whilst I was out there, just seeing the shortages of chemotherapy, zero access to radiotherapy for any cancer patients in Gaza, either patients having to go over to the West Bank or into Israel. No PET scanner, which for our patients with lymphoma and our patients with solid tumours, so important to have access to PET scanners. Patients that get TTP from a haematology perspective, no access to plasma exchange. From a paediatric point of view, very limited services at Al-Ran TC as well. And acute leukemias all transferred over to the West Bank, but often with delays. Now, I'm sure for any of you that know working in the haematology setting, when it comes to chemotherapy, particularly for acute leukemias, you pretty much need to start chemo yesterday. So when you're looking at long, lengthy waits to get children and adults into the West Bank for their treatment, it's just simply not acceptable. But these resilient nurses work with this day in, day out. So we set up a haematology MDT, and we equally developed some nursing competencies as well. But I say, unfortunately, that's all stopped now. We're not doing any work with the team in Gaza at the moment, understandably. But are still continuing to work with my colleagues in the West Bank. And I really want to hand over to my colleagues in the West Bank now, because today's not about me at all. This is about the amazing work that they do. So first, I'm going to hand over to a very good friend of mine, Tamer. Tamer, the floor is yours.
Hello. Can you hear me well?
Yes, sir.
Yeah, thank you. Thank you for this great introduction. What a great introduction, Matt. Thank you. So, my name is Tamer Al Jafari. I'm from Bethlehem, from Palestine, from West Bank. I'm a palliative care nurse, oncology and palliative care nurse. I had been graduated in 2016 with a BA in nursing. Then in 2018, high diploma oncology and palliative care. Then another certificate, master degree in nursing management in 2021. My work experience, I worked in Augusta Victoria Hospital in pediatric department, geriatric medical department, and the last 4 years in Augusta Victoria Hospital were in palliative care. I was a palliative care nurse, and it was the first palliative care department in Palestine, which works inpatient with oncology patients and any other patient with palliative care needs, such as interstitial disease and heart failure, respiratory diseases. I worked in Al-Quds University. I was teaching over there for nursing and medical students, laboratory technicians. Currently, I'm teaching in Bethlehem University for the master students, oncology and palliative care, clinical and theoretical teaching. And currently as well, I'm teaching in Hebron University for the BA nursing students. And next slide, please. And this is my team. As I said to you, as I mentioned, that we live in West Bank. Currently, we initiated a new service since 1 year in July 2023. Its name is Bethlehem Care Hospice and the Trust. We serve the patients in Bethlehem. This is the first home-based palliative care service in Palestine. Currently, we have. So, can you hear me? Yes. Yeah. We are currently working with the patients in Bethlehem. So in the discussion, I would like to talk about some issues, difficulties which we are currently facing. Thank you all.
Amir,
Yes.
can I just add in that you're the first nurse prescriber in the whole
Yeah,
of Palestine as well? It's really, really important to mention the great innovative work
that's
you've done.
that's that's the most important thing. Yeah.
He can prescribe medication for his
Yeah,
patients.
actually, since 2018, that was the incredible thing in Palestine for the first thing, as well as I can say it's the first time in the Arabian world that we have a nurse who can prescribe, or uh, a prescriber from non-medical background who's a nurse, and I was the first non-medical prescriber. It was very hard to do that for the first time because this physician and nurse joke, as I said, but finally we did it after the support of my my colleague and my manager, who was a physician. His name is Dr. Wasim. After that, I start to teach many nurses how to be prescribers. Now they become two, and now I am currently teaching my colleagues. So I'm teaching another three. So we are now five uh, non-medical prescribers in Palestine. So all of us, we can prescribe. That's the most important thing. Thank you, Matt. Yes. So we can move to the next one. Uh, yes, I think Jihad.
Yes, good morning for you all. And thank you for inviting me for this. My name is Jihad Hawamda. I am the Nursing Continuous Education Officer in Augusta Victoria Hospital. I am a registered nurse with strong experience in delivering quality of care. I have a professional more than 13 years in clinical experience in hematology, oncology, and palliative care in both oncology, in both adult and pediatric patients. I have an experience in leading nursing teams in a high pressure environments. I achieved my PA in nursing science in 2011, and then in 2018 I get my high diploma in cancer nursing and palliative care from Bethlehem University. And I in 2022 I get my certified oncology nurse from the Oncology Nurses Society. And the last achievement was the master degree in oncology and nursing, oncology in master in oncology nursing and palliative care from Bethlehem University. I am acting as a continuous education officer in Augusta Victoria Hospital. I get a lot of training in King Hussein Cancer Center in hematology and bone marrow transplant. And now I am working with the nurses to achieve their training in mainly in oncology based on based competency training in oncology and palliative care. And also I am working with Bethlehem University as a clinical instructor with the master students. I working also with the bachelor degree students from Hebron University also. The next slide, please. I am living in Hebron, which, as you see in the map, which is in Palestine. It's southern the West Bank. It's around 220,000 people. And in the right side, this is our hospital. This is my workplace. It's Augusta Victoria Hospital. It's operated by Lutheran Federation, and it contains a comprehensive cancer center. It contains pediatric hemato-oncology, adult hematology with bone marrow transplant. It contains a surgical oncology and also a radiation oncology. Thank you.
Good morning. Hello. Good morning, all. My name is Duha Al-Ayaseh. I'm from Hebron, Palestine, 27 years old, palliative care nursing teacher. I graduated from PSN from Hebron University since 2019, and I studied Master Oncology and Palliative Care Nursing at Bethlehem University, and I graduated 2023. Next slide, please. About my work experience, I worked at Bethlehem Care and Hospice Trust as a palliative care nurse with Mr. Tamer Al-Jafari. It was very great experience and added a lot of knowledge and skills for me. Currently, I am working as a palliative care teacher for PSN students at Hebron University. I started teaching the course in January 2023. Thank you.
Thank you all. I'd like to open up a bit of a debate now, if that would be okay, and ask you all some questions. And I think the first question I really want to ask you all, and it's a really important question, is how are you all doing right now?
I'm fine. I'm currently working, as I said, in Augusta Victoria Hospital. It takes from me sometimes 3 to 4 hours from go and back from home to work. And in the current situation, it's really difficult for us as an employees to cross as you know, there's a lot of checkpoints, and it needs a lot of time to go to our hospitals.
Yes. I would like to add something. I think this period is the most difficult in Palestine. To talk about myself, it's true I live and work in the city of Hebron, but due to the unexpected closures and checkpoints, the road takes a long time. Also, sometimes my sessions moves from face to face to Google Meet due to some of problems or unpredictable closures roads. We will with Mr. Tamer.
How are things for your students, can I just ask? Are they able to still get to university for teaching? Can they get to their placements?
Yes, some of students, the previous semester, the students took both face-to-face and Google Meet online, but the teacher should go to the university. But this semester, every student should go to the university and take the session face-to-face. But sometimes related to unpredictable checkpoints and closures routes, the students cannot to go to the university, so move from face-to-face to Google Meet online. And this is the big challenge for me and for my students.
Thank you. Tamer?
Yeah, Matthew, thank you for this important question. How are you? This is the most important question, actually. We usually say I'm fine, but for me, I think that we are Palestinians, we are not fine. But I'm currently working in Bethlehem Care Hospice and Trust. We are serving a huge number of patients here, cancer patients. This is a home-based palliative care service. We are trying to use the available resources to treat our patients. Unfortunately, many times we cannot move freely in Bethlehem city, even the city center, okay? Between villages sometimes to visit the patients. Many times we decline the visit because I feel that something wrong may happen to the team. Actually, one of my team members was arrested 2 weeks ago. Yes.
Forgive me for bringing this up, but I think you had a problem with your car, didn't you, as well?
Yeah, my car got a shot, or 6 shots, gunshots actually, and it was broken. So with this car, I usually use it for the home service, and many patients didn't get the service because of that, and I was really frustrated. You know, it was just um, uh, in front of my house. We were not doing anything. We were just sleeping at home safely.
I don't know what other people think, but I got in my car this morning safely, drove to work, no problem, didn't have any checkpoints to go through. And I don't think many of us that haven't been to Palestine can actually comprehend what it's like to work, how you work, and you just seem to get used to it. And I've never ever understood how you do that. And when it comes to resilience, I don't know a more resilient group of nurses that I have worked with than my colleagues in Palestine. So I don't have any answers at all. What's the general feeling amongst your colleagues? How are they feeling?
Well, it's difficult, you know. 3 days ago, I visited a new case. He was going to his work. We say it the area behind the wall, which is in Jerusalem, because here in Palestine it's 3 areas: the Israeli, West Bank, and Gaza. So he was going to work in the area which is occupied by the Israelis. So when he went over there, the soldier just saw him, arrested him, hit them until they just put them on the front of the car, the Israeli soldiers, a huge car. What you call it? I don't know. اللي هو الجيب. And just they اللي هو يعني جروه شباب.
Take him, maybe take him aggressively.
They start to they take him with them and they just hit him until he get a spinal cord cut.
Can I
So
add
something? I visited him 3 days ago as a patient who cannot move at all, while he just went to his work.
Jihad, go on.
Yeah, I want to add something. Thank you, Tam and Matthew. We are as a cancer nurses also. When we wake up from sleeping, we look to our phones to check if our gates are open or not. If the gate are closed, you need to move sometimes triple the distance to get to your work, or sometimes you need to sleep in the hospital in order to cover your work. And I want to add also something. I left Amman yesterday. I left the hotel at 8:30 a.m. and I arrive my home at 9 p.m.
13 hours just.
Yes, 13 hours to get my home.
To go from Jordan to Palestine, which is you can see it by your eyes. Yeah.
So the next thing I'd like to ask you all is, can you talk us through what cancer nursing was like in Palestine when you first came into the profession? Duha, can I turn to you first, please?
Yes, I think from previous until now, the borders, the checkpoints, and lack of oncology services in Palestine. Palestinian living in Palestine in 3 areas: Jerusalem, West Bank, and Gaza. So I think this is the big challenge for the cancer patients and for their relatives, companions, and their families. This is the first big problems. I will to continue with Tamer to talk about previously before 2016.
Yeah, thank you, Duha. Actually, previously before 2016, there was a skillful, hardworking oncology nurses, but without certificates. Skills without the knowledge needed for cancer nurses as what we know now. I mean, the guidelines for nursing practice, nothing related to palliative care. There was no prescribers. We were not participating in any international conferences, we did not know Matthew. Jerry O'Hare, Dr. Jacqueline Moore, and we didn't know the GPON, ISMO, IONS, even the NCCN guidelines. So, as we all know, to be competent in oncology, you need to have the appropriate attitude, skills, and knowledge. And in many points, if you do not have the appropriate knowledge, you may face many defects in your practice. We knew that when we studied the higher diploma. That's what we knew. And the master in oncology and palliative care.
Yes. Also, cancer care has come a long way from general nurses caring for patients with cancer using primarily bedside and comfort measures. What we need is to the development of oncology nursing as a specialty with defined knowledge base, as Tamer said, and also to be supported by researchers and expert practices. Also, without specialized education or training in oncology, and early cancer nurses were often forced to be creative in caring for patients with various complications of cancer treatment and the cancer itself, or such as burns coming from radiations and pain and other symptoms also.
The one thing I'd like to bring up as a non-pediatric nurse, I've got very little experience in pediatric nursing, but the one thing that really surprised me when I was at Al Najjar was the fact that the parents of the children in Gaza that were brought over for leukemia treatment to West Bank, the parents weren't always allowed to accompany the child. I don't know if any of you can expand on that at all, because I find that just morally inconceivable that a parent wouldn't be allowed to be with their child when they're ill, let alone anything else.
For the Gaza patients, I'm working in Augusta, Victoria, and before the war, we get a lot of patients from Gaza, pediatric patients. And if the parents are below 50, they are not coming with the patients. They bring another companion to be more than 50 years to be with their patients. And sometimes the family bring another one from not relatives to the patient to come with their child.
Yeah, maybe yes, excellent, Jihad. Maybe Duha would like to say a story about a child from.
Yeah. I think many children were supposed to get treatment at AVH, I think, but we were stuck in Gaza due to permissions. This is the big problem, permissions refusal. They need a permission to enter Jerusalem because it is under the Israeli occupation. Many patients died on borders while waiting the permission. Even some of them get the permission after death in Palestine. This is the big challenge and difficult and sadness for family, for relatives, for patients.
Yes, and even they need the permission to enter West Bank.
Yes, this is a new afterward.
Yes.
Yeah. I think this is a big problem.
Yes.
So what's cancer care looking like in Palestine right now? And have any of you got a feel for what's happening in Gaza? I know you're all based in the West Bank, but
yeah.
I'm really interested to know if any of you've got a feel for what's happening there at the moment from a cancer care point of view.
Yeah, there is a pros and cons in this question. I like to be a positive person, but in this situation, I have to be more realistic. It is a horrible situation right now. Injustice, unequal. There is no safety for cancer patients. Healthcare providers are at high risk when they are going to their work or during their work. According to patients, some patients currently are waiting for XGEVA. Some of my patients are waiting for the XGEVA since more than 1 month because it's not available in the stock of the government. The same like other treatments such as Keytruda, and after 1 month, if the medication is still not available in the hospital, they need to get to go to receive it in another hospital, non-governmental organization, such as Augusta Victoria Hospital. But this process needs a governmental financial coverage and needs time and needs permissions. So it sometimes take more than 1 month after the process starts. So it needs more than 1 month when the patient just reach to get his treatment, you know. Maybe I would like Duha to talk about nurses and teaching right now.
Yes, we should talk about the teaching. Currently, the situation about the teaching is better than how it was previously. We are teaching oncology and palliative care in different university, theoretically as a main course with special clinical training in oncology departments. We have nurses prescribers such as Mr. Tamer in Palestine. We get many referrals from oncology physicians to treat them as a palliative cases. I remember when I studied PSN at Hebron University, there is no palliative care module or courses teach for students. But recently, I think since 2020, started to study the palliative care course for PSN students to know about what is the meaning of the palliative care and what is the importance of the palliative cares, who needs palliative care. I learned my students about the guidelines, CTCAE, like I think it's very important to learn about this guidelines in palliative care. Yeah.
Yeah.
Thank you.
And I think also the role of oncology nurses is expanding and adapting to care needs and scarce resources. Also, I think also supported oncology nurses is a vital to ensure people with cancer are appropriately cared for and guided through their individual journey in the time of utmost need of and vulnerability. Also, a holistic and compassionate approach focusing on physical, emotional, and spiritual needs of patient will be embraced and modeled. And the establishment of early detection programs, the only active screening program in Palestine for breast cancer now, and is guided by the Ministry of Health and Augusta Victoria Hospital. We have in our hospital we have a mobile clinic. They have a program and they spend their weeks in each village, and each week they have a special village and they make a screening for breast cancer.
So I know what my hopes are for the future of cancer care in Palestine, but I'm not on the ground working there. You obviously all are. So the $1 million question, what are your hopes for future cancer care? What does it look like to you in Palestine?
I think many. Can I start there, Mr. Jihad?
Please.
Yes, I think as the oncology nurses and palliative care nurse, we need equitable treatment for cancer patients. This is the first our hopes, I think. Yes, equitable.
100%.
Yes.
Also increase the specialization and advancement of nurse training, including an increase in specialty of oncology nurses and professional cancer navigators who provide continuity of for patients and their families throughout the entire cancer treatment process by helping them to navigate the system and communicate with other healthcare professionals and community agencies on their health, their behavior. So the future is pointing toward an increased advanced practical nurses, advanced practice nurses, as they function to meet both the medical and nursing needs of patients through a model of collaboration, shared responsibility, and accountability.
Yes.
Yeah, actually, for me, tomorrow I will talk more about what we are currently facing more and in depth, in details. But if you ask me right now, what is my hopes? I want more prescribers, nursing prescribers. I want to empower nurses more and more. I want nurses to go out of this borders, just to go and to say that we are here and to initiate the Palestinian Oncology Nursing Society. We need that,
Yes.
and we are going to do that. I'm sure that we are going to do that. This is a strategic plan for me and Jihad, Doha, and many other colleagues. So we will empower nurses. Thank you for this question, Matt.
No problem.
Really, thank you.
My last question for you, and this is more looking inward, us at GPON. What can we do as a community in GPON to support you all?
To make more Jihad, Doha, and Tamer.
Is there anything we
Right.
can do to help you set up, particularly I think the Palestinian Oncology Nursing Society, I think is essential for you guys as a community to have that. But is there anything you need from us at all?
Can I talk?
Yes, of
Yes.
course.
I think the GPON members can help and support us to participate like these workshops continuously, and by encouraging the cancer nurses, the palliative care nurses to continue their studies after master's degree like PhD, because in Palestine there are lacks like this study. The first studies for master in oncology and palliative care started in Bethlehem University just. We lack of PhD in this specialist or palliative or cancer. I think the clinical oncology and palliative care nurses like me, Tamer, and Jihad deserve to have this opportunity. Yes.
Yeah, thank you, Duhan. This is our voice
Thank
from
you.
Taha tongue. Yeah.
I hope. I remember when I decided to study palliative care from during study PSN. Mr. Jihad learned me at PSN degree at Augusta Victoria Hospital. After that, I decided I should to continue my studies in palliative and cancer. So after that, Mr. Tamer learned me in masters, and Dr. Matt. I remember what Dr. Matt comments in UNISACT oncology. The first students, you write one words in her box. Yes, I remember your words. I cannot forget. Thank you, everyone. Thank you. Many thanks to everyone who established GPON. We appreciate the opportunity of allowing us to join you in the conference to talk about Palestinian cancer and to talk about the Palestine in this difficult phase. Thank you.
And one of the most important thing that your presence here as a GPON and hearing what we are saying and to care about what is happening right now in Palestine, it means a lot for us. So you already helped us. You did a great job. So thank you. And we promise you that we will keep our resilience more and more until we get out of all of these triggers.
Yes. Thank you, GPON. Thank you, Matthew.
Thank you.
Any question from someone?
I just want to thank you all. I think Annie put something in the chat about inspirational. It really does fit with you guys when you talk about what you do. You are such inspiring cancer nurse leaders. And I, for one, feel very fortunate to work with you and call you colleagues. I always find myself a bit lost for words whenever I talk, particularly now. I didn't previously, but particularly now, I find it really hard because I can't imagine what it must be like. But to see your resilience and to see you still trying to find ways of making things better for the community, yeah, I struggle for words, but thank you doesn't seem quite enough. But shukran.
Thank you. Shukran.
Thank you.
Shukran is thank you.
Thank you for your
very much.
And anyone would like to ask any question? I think the time.
Thank you much. Thank you, Jihad. Thank you, Duha. And thank you, Tamer. This was so painful, yet very inspirational. I feel quite emotional. And Matt, thank you for doing an excellent job. And there have been excellent comments coming from the chat. Hope, inspiration, motivation. We feel so humbled. What I want to say is GPON is behind you, and hope needs action. It's not enough. We need to continue with teaching and training, create more nurse prescribers, get more people to do oncology nursing, so that even during the time of crisis, there is some hope and some action. I'm beyond words. I can't thank you enough for sharing those really, really significant and emotional, so heartfelt experiences. The challenges that you face on a day-to-day basis, the opportunities that we have, the opportunities that have been missed, and the opportunities that can be created in the future. And we need to continue this incredible work, and GPON is behind you, and we'll continue to support you. Thank you all so much for taking the time, and yeah, it's been incredible. And I'm sure a lot of other people who are listening in feel the same, and we will do what we can to support you. Thank you so much.
Thank you. Thank you very much.
Thank you.
Thank you.
I feel like, like this is a topic that deserves a whole conference to itself. Just so much that we can talk about, so much that can be done. And I do urge everyone, like to keep raising awareness and keep working. And Matt, thank you for asking that question. How are you all doing? I think that was really incredible and powerful. And it shows empathy. It shows we are with you in Palestine.
That's a beautiful summary, Flora. You nearly brought me to tears.
Thank you. And I think we are now, if there's any questions that anybody wants to ask before we move on, I think we'll just take the opportunity since we've got it. And I think I know we're running behind time, but just in case there's anybody, any questions that are in the chat, anyone? Yeah. I think there's more comments than anything else. So thank you again, once again, and we are with you. I'm with you. Incredible, and I'm sure so is everyone else. Thank you, and I think it's over to you, Dilnashin now.